This Christmas, there's a Super Ham and Grog giveaway on all games of the National Lotteries Authority. Yes! When you purchase $12 Lotto, Super 6, Play 4 or 3D on the same tickets, you can win ham or grog. Look out for your winning vouchers stating ham or grog. All prizes redeemed at NLA headquarters, Falls Avenue. Also, collect $12 non-win scratch tickets. Provide contact information and drop-in box provided at NLA headquarters or agents island-wide. For a chance to win one of 50 hams or one of 100 bottles of grog to be drawn on Monday, December 21st. It's a Super Ham and Grog giveaway. Merry Christmas from all of us at the National Lotteries Authority.
Hold something. Bring the buckler. Hold something. Hold it or you roll it. Christmas time, I want you to hold something.
Good evening and welcome to another edition of Roundtable Talk. On this evening's edition, we will be talking about the new and emerging developments in respect of COVID-19 here in St. Vincent and the Grenadines. On the panel is Chief Medical Officer Dr. SIMONE KEIZER BEACHE. We also have Medical Officer of Health, Dr. Roger Duncan, and we should be joined a little later on by infectious disease specialist and advisor to the COVID task force, Dr. JERROL THOMPSON. You guys have been back and forth on this program all year. What is the status of COVID-19 in St. Vincent and the Grenadines as of today, December 16th?
So thanks again for having us. As of today, we have hit the 100 mark. We now have 100 cases of COVID in St. Vincent and the Grenadines. Just today, we we're announcing 2 additional cases. So we now have 18 active cases with 82 persons having recovered. So that's where we are now.
What are some of the challenges in managing COVID-19 in St. Vincent and the Grenadines right now? What are some of the major challenges?
We've established sometimes, thanks for having us back again. We've been established sometimes that the greatest risk of people who are coming into the country. So we had 2 things happen. The frequency of flights have increased as well as the volume of passengers on these flights have increased. So that's one risk by itself. But the other challenge that comes is when people are not adhering to protocols. So if you are to quarantine yourself for 14 days, that depending where you're coming from, you must spend 5 of these days in a approved facility. People still insist on wanting to move around. They still insist on wanting to have gatherings at the place. I mean, just this weekend, just on Sunday, we had to dispatch the police to a home where a guy who had just come out of his 5-day quarantine was having quite a bit of bashment going on his premises.
Party?
Well, I mean, and that's the thing about this. It's not just the people who are coming in. There are local people, too, who have been here, who are really not paying attention that, look, my neighbor Tom Jones has just returned from the United States, or he's just returned from England, and therefore I need to distance myself from him until his quarantine is complete. It's in your best interest as his neighbor. It's in his best interest, too, so that he doesn't breach the quarantine protocols. And it's in the country's best interest. So I think that's the greatest problem, the challenge that we're having. The volume of people not adhering to protocols.
How are we going to overcome that?
Well, so we've been taking some people to court. I mean, with all due respect to the court, I understand that there is a process and, there must be some due process. But it's very time-consuming. So our staff end up spending days in court waiting to give evidence. And days when you're supposed to be doing other things. So that, delays you sometime in contact tracing, delays you in testing people and so forth. But we've been talking. We've continued to, admonish people, please, when you're coming at the airport, tell you, this is the protocol, please adhere to it, please stick to it. But some people just not listening.
Okay, so the 5 days mandatory in a hotel. And who manages the process that ensures that the visitor, the traveler, the guest, whatever you want to call it, him or her, is really adhering while on the premises at the hotel? Because I've had some personal observations that warranted this particular question.
Well, the Hotel and Tourism Hotel and Tourism
Association
Authority and the
Tourism Authority
and the Hotel and Tourism Association are the ones who are responsible for recommending the facilities for quarantine and also ensuring that they meet the standards for quarantine. We've heard some things too. I mean, some of them are difficult to verify. We've asked and people have said no. I think one of the biggest thing on the properties themselves is the commingling of the guests. I mean, they're not huge properties, so distance between rooms is not that great. But people still, try to congregate in the corridor, some common area. And, we've been asking them as well as the owners of the properties, please don't allow them to do that and try to make sure that doesn't happen. So again, a lot of it depends on, one, the property owners themselves and how they're enforcing what the protocols are, and the very people who are there, because there are some property owners who call you and tell you, well, clearly I can't go with these two. You need to help me. You need to probably get somewhere else for them to go, and so forth. But those are difficulties that we have.
And what are the specific standards that a facility or property must need in order to be classified as an approved?
So your staff must be trained in the COVID protocols, especially in terms of protecting yourself, what you do, what you don't do, when you wear masks, when you wear gloves, how you clean, how you sanitize the place. And there also must be security. So that's to prevent people from either leaving the properties or other people from entering the properties. And those are the basic things.
Yeah. Okay, so we have currently quite a bit of yachts and so on in the harbour. What sort, I know people have been inquiring, what are the protocols relative to these visitors on board the yachts?
It's not different from those people who will come in by air. So when the yachts enter, they will immediately be tested upon arrival. That's the first test. They'll quarantine on the yachts and they'll wait for 5 days and they'll be retested again. So if they're negative at that point, we allow them to move around in a controlled way. So they need to log daily with us where they are, where they're going, what they're doing, submit temperature charts on a daily basis of their crew, as well as the crew and the people who are on board with them. Okay. So it's not very much different from what we do with people arriving by air.
There are some new protocols that went into being yesterday, the 15th. What are the major elements, changes, etc.?
The major change is that persons coming from high-risk countries now have to come with a 72-hour test or 3-day-old test. So that's moved from 5 days. So now everybody coming into St. Vincent must have a test that is no older than 72 hours or 3 days old. That was the what was required for medium and low-risk persons, but now we have moved it to include the high risk, and that's a major change. I think we moved Grenada up to medium, but they might have been there before. But the main thing is because we have seen these increases over the last few weeks, we have recorded too many new cases. We have now at 100, where a few weeks ago we were down at around 70 something. So we are And we're looking at the increase in the positive rates in the US, in the UK, Europe, and in Canada, and all around us. So we decided that we would move up to the 72-hour in an attempt to further filter and reduce the risk of somebody coming in and testing positive on day 1 or even day 5. Because if you've noticed also, quite a few of the persons have been testing positive, who test positive, it happens on day 5, and even more worrying on day 7 and day 8 and day 9.
So I've also heard a lot of queries about the fact that people are now, in fact, testing after day 5. So can you explain how this can possibly happen for those who are curious?
Okay, so in some circumstances, it might be that we have a particular interest in the person. Is it that the person was in contact with a known positive, or is it that the person is in an environment that requires that we do increase surveillance and increase testing? We have quite a few protocols going on, and depending on your category, if you are high risk, say right now, unfortunately, some of our farm workers have been testing positive, and so you might be in a high risk job, or you might be in a situation where you are moving pretty early in your quarantine period, and we have to be extra cautious, and so we do increased testing. Or it might be that somebody turns up or complains during that period of not being well, and we test them again. So even though, strictly speaking, the majority of persons would be tested on day 5, and after that, as Dr. Duncan said, there's the temperature reporting. We advise persons, if they're not feeling well, to let us know. There are some groups where the protocol for them even being here requires that we test them further after the 5-day period.
After the 5-day period. Beginning yesterday, the test has to be 72 hours.
Yes.
Yeah, that's a 3-day
That's
window.
a 3-day.
So if somebody shows up at the airlines or what have you without that, would they be able to board the flight?
They should not. We sent out last week, we reminded all of the airlines that the new protocols, that they must abide with the protocols, and we sent the protocols. And we said to them, and this is Dr. Duncan's area also, that if you turn up, if they allow somebody to board a flight and arrive in St. Vincent without the required confirmation of a reservation in an approved facility and without the appropriate test, it would be the airline's responsibility. I suppose I shouldn't say that, the airline's responsibility to put that person up, and it might be even longer than the 5-day, because if you turn up without the appropriate tests, you're probably going to need mandatory quarantine for an even longer period. So most of the airlines, so each day we get calls from, say, Barbados, from an airline to check to see if this particular person can be allowed on, because you might have some queries about what is a 3-day, what's 72 hours. Is it 72 hours from the day? So you take, I do my swab on Monday, so is Monday, Tuesday, Wednesday, is that a 72-hour period, or is it from the end of each 24-hour period that you come? So we get queries, but the idea is that the airlines are not to board anyone who has a test that is older than 72 hours and who does not have a reservation if you're in a high-risk category.
Would you say that the airlines so far have been cooperative in this respect?
Not very. There's one in particular that continues to breach the protocol repeatedly, and I'm not so sure why this continues to happen. And they, same thing, every time that they come. But by and large, most airlines are complying and with the protocols that are doing exactly what we asked them to do. And if they have difficulties, as Simone pointed out, then they would, ask the question as to could this be done or couldn't this be done.
Okay, so we'll be back in just a moment. When we come back, Dr. Thompson will join us at the round table. Back in just a moment.
So probably I could go.
and dice. Together on one scratch ticket can make your dreams come true. Yes, it's Fire and Dice. The new $10 scratch game with thousands of dollars to be won. Match your numbers with any of the winning numbers and win the prize shown up to $125,000. You can double or triple your prize with Fire and Dice. Available from all lotto agents and runners. There's cash to catch with just a scratch.
Yeah.
Welcome back. Dr. Thompson has joined us. Welcome. I want to start by asking you, I've been reading about a new variant in COVID-19. Can you tell us some more about that new variant?
Yes, this is a new variant that they've picked up in the southern part of England. They've described it in certain letters and numbers and so on. But it's purported to probably spread a little bit more easily, but it hasn't given any indication that it causes more severe illness or so. They have not necessarily seen it in any other location. How different it is to the coronavirus that we've been seeing all the time. We know that there have been a number of mutations, and so there's always mild, small mutations that's taking place within any kind of viruses, and so the extent to the degree of this mutation is something that is still being looked at, but they have been able to recognize that it is a mutation. I think that we don't have all the information in, and we're going to hear a lot more about it and so forth in due course. But I don't think it should be it shouldn't be any undue alarm. Of course, I'm sure that the tests that are being done are going to pick up the virus in the same way. It isn't going to be able to hide. It isn't going to be able to run. Also, I think, the tests that we do, the PCR tests, are still going to be able to pick it up. It's just that we have to make sure that we pick it up early at the borders and so forth, or persons before coming to St. Vincent, they have their tests, and they're proven to be positive, and so before coming, and so avoid coming to St. Vincent. Yeah.
The veracity of the tests that people arrive here with, how happy are you with that?
Well, I mean, there are people coming from all over the world with all sorts of tests. But the protocol says that you must have a PCR test. Yeah. So we do not accept rapid antigen tests that are being done, but people are still turning up with these. Again, there's a breach of the protocol, and then, you end up having to retest them. And your 5-day quarantine might extend to a 7-day quarantine for these reasons. But then again, people are people. And, if there's a way you could get away with something. Mm-hmm. So what we actually do is we keep these test results with us. And if somebody who was entered with a negative test tests positive up at entry, then we'll be suspicious as to where was this test done and who did this test and how it's done. I mean, some people come with some vague things like COVID-19 test negative, and you're wondering what did you do, what sort of test you did, and where did it come from?
Really?
So we do have these problems.
Okay, question. If you take the vaccine, there's somebody going on to the vaccine, is it the same protocol for that person to still have a pre-test or still have to be in quarantine for the 14 days? I guess somebody's asking if you take the COVID vaccine, if you'd still be required to follow the same protocols that are now in place.
I suppose Dr. Thompson would elaborate, but my understanding is that even though this morning I was hearing some other additional news about one of the vaccines being found to probably have some properties which would decrease the likelihood of you actually getting the COVID. The vaccines that are being produced now, the main effect is to reduce the severity of the illness you will have, so that you could have, you can have the vaccine, but you could still
transmit the virus.
Right, you can still have the virus. And so for now, I think our recommendation would be that we would still want to do the testing, because remember, the testing is looking for the actual viral particles. So that for now, I think you would still have to have some level of testing and quarantine.
Yeah. I think that right now, taking the vaccine is to help prevent you from actually catching the real coronavirus, and that 15%, 5% chance of it being very severe and you having to be intubated. That's a primary thing. I'm sure that in the upcoming months and year that there'll be protocols as regards maybe to enter into a country, they may require vaccination. Like to travel some countries, you need a yellow fever vaccine. You need certain type of vaccine. Matter of fact, I know people migrating to England or to the United States have to show that they are HIV negative, and so it's from some certain countries. And so I imagine that this may become, but there's no evidence that that is going to take place right now. So those persons who get in the vaccine early, here in St. Vincent, we have not as yet established any protocol that you're allowed a free entry into St. Vincent because of the vaccine. But I imagine that if somebody is vaccinated, there's a chance, if we do the ordinary antibody test on you, it will show up positive. But your PCR test, what we do in terms of checking the swab in your nose, and so should always be negative. That is what I'm sure we're going to rely on for the time being.
Okay, somebody wants to know, will the staff of the Logos ship who will come ashore to sell their books, will they be doing the established protocol?
Okay, so the staff of the Logos ship, they are actually doing a even more strict protocol than the average set of persons. So they're going to have 3 sets of tests while here. No one is going to come off of the Logos until the entire ship is cleared. And when they do come off, the exhibitions would be onshore in a well-ventilated area, open air. So they are going to be following that protocol. We can be confident of that.
Okay, so, and they'll be around for how long?
They leave around January 7th or something like that. So they'll be here roughly a month.
Okay, and there will be no boarding by locals?
No boarding. Locals will not be boarding.
I'm not sure if I gave you this question. The persons have to, if you did 4 COVID tests, all are negative, and already did the 5 days, do you have to carry out the full 9 days at home?
Yes.
Okay, yes.
Unless you have some special waiver to not be at home.
Okay. I think this is a similar question. Somebody was wondering if you quarantine for 9 days at home. If you have to quarantine for 9 days at home, different question, after the 5 days hotel stay. Yes. It's not optional. If
you are coming from a high-risk country, that is the protocol. If you're coming from a medium-risk country, your quarantine will be between 48 to 72 hours. If you are coming from a low-risk country, the quarantine might be 24 and might be no quarantine at all. But everybody comes with a test.
So can you differentiate the medium risk and the low risk for us? Because I think that would be important for...
Okay. So your low-risk countries right now would be Dominica, Anguilla. There are very few of them. St. Kitts, Nevis. Those are the lowest. And why we say these are countries that have very low levels of COVID. There's no community spread. There are no local clusters. There's a very low risk that someone coming from one of those countries is going to be COVID positive. The medium risk countries are Barbados, Grenada, Antigua. Those are the medium risk countries who have a little more activity going on, but there's still not the community spread that you might find in a country, say the USA or Guyana or Trinidad
Or Jamaica.
Or unfortunately St. Lucia at this point. So
Okay.
those are the high risk countries.
So those are the big ones. Let's talk about vaccines, the different vaccines that are now on the market.
Right. Well, there are over 170 vaccine candidates. A vaccine doesn't become a vaccine unless those vaccine candidates have gone through all their trials. They have been studied at the end of the trial by a scientific body, an independent body, and then approved by an agency that's authorized to approve it in that country. So you notice that a vaccine may have reached a point of being approved in England. It's approved by that country's body. It has to be approved by the Canadian body. It has to be approved by the US body and elsewhere. So that, you don't really get an approval in one country and there's approval in the rest of the world. So far, you would say that one vaccine or two have reached that particular stage. The Pfizer, BioNTech, and the Moderna vaccines. And these are some very special vaccines that have used some new methodologies in terms of creating vaccines. And then we expect in January the Johnson & Johnson, Janssen, and possibly the AstraZeneca, which are using a different method to probably gain approval. But I can tell you already there are about 10 or 12 vaccines that have fallen off the charts that are no longer being because they have had problems and so. So some people think of vaccine as being one vaccine, but there are many candidates, and I believe at some point in time going into next year, we will see that race kind of narrowed. It's competitive, but at the same time, all these vaccines have to be studied. And like a student taking an exam, we expect them to be graded. And it would seem as if some of these early vaccines, the Pfizer and to some extent the Moderna, are going to be graded. They're hoping, I think they're getting almost like straight A's. You understand? And vaccines, we expect them to be at least 50% efficacious, the effectiveness. But the two we're talking about, the Pfizer, are 94, 95% effective. So that's remarkable, that's really remarkable. Others may not reach that particular stage of efficacy. But besides being effective, we also want to know that nobody has died during receiving the vaccine. That's important. But in the case of this Moderna vaccine, which is now going through its stages, would have gotten some FDA approval, but is still going through some stages of approval, that it is showing that besides being effective, it is stopping persons from even becoming asymptomatic carriers. You know what I mean? And that is interesting. In terms of severity, it's also seeming to stop persons from becoming one of the 15% who get a severe illness where they get respiratory problems and so, and much less being intubated. And that's also remarkable.
We'll talk some about that, because I want you to respond to people who are saying that the vaccine has been developed in too quick a space of time.
Yes.
So we want to address that when we come back after the second break.
This This Christmas, there's a Super Ham and Grog giveaway on all games of the National Lotteries Authority. Yes! When you purchase $12 Lotto, Super 6, Play 4 or 3D on the same tickets, you can win ham or grog. Look out for your winning vouchers stating ham or grog. All prizes redeemed at NLA headquarters, Falls Avenue. Also, collect $12 non-win scratch tickets. Provide contact information and drop-in box provided at NLA headquarters or agents island-wide. For a chance to win one of 50 hams or one of 100 bottles of grog to be drawn on Monday, December 21st. It's a Super Ham and Grog giveaway. Merry Christmas from all of us at the National Lotteries Authority.
Hold something, bring it back up. Hold something. Hold it or you roll it. Christmas time, I want you to hold something.
Welcome back, and before we pick back up from that discussion, someone wants to know, directing specifically at you, Dr. Thompson, would you take the vaccine now if it were available to you?
Well, I would say yes. I would take that right now. And I would ask Roger, if you had the Moderna or the Pfizer vaccine, I would take it right now. But I want everybody to know that they are justified in having concerns about safety. And so the whole history of vaccines is there before us, and everybody is going to have some level of skepticism. But I am not a shareholder of any of these vaccines, so I'm not promoting them. I want to look at it from a scientific point of view. And I believe that the early studies show that efficacy is excellent. And from a safety point of view, it seems to be sound. Now, is the period too short? Well, the method being used for the Pfizer and the Moderna vaccine has been a method in progress they've been using, or trying to develop since 2005. And the fascinating thing is that the Chinese were able to find out the genetic code of the virus. And those two factors, having the genetic code of the virus has helped in terms of being able to plan properly. In the past, we didn't have the technology to know the genetic codes of these viruses. And so things were a little bit more trial and error. But I think the science today has been brought into the process. And I would say that I'm impressed with the efficacy. Now, in terms of safety, no doubt these things are going to have mild or possibly severe reactions. The mild ones, you're going to have a fever, you're going to have a rash, you could have some muscle aches, you're going to have some joint pains, maybe some belly pains with it. And these are what we see with any kind of vaccine. And you know what? It tells us that the vaccine is working. It tells us that the vaccine is working. So when you have those symptoms, now there have been some reports for patients with the Pfizer vaccine who are allergic, who walk around with something they call adrenaline, epinephrine in a pen. Mm-hmm. And they use that in case they eat shellfish or crab by mistake, or they take they take some medication by mistake that they're allergic to. They can give themselves an injection to neutralize the allergy. So they are advocating anybody who has those type of conditions, don't take this vaccine. Clearly, they haven't studied the vaccine in pregnant persons. They haven't studied it in children, persons under the age of 18. So this is just for persons over the age of 16 or 18. And I would say that the benefit, especially to healthcare workers, to the elderly, persons with some sort of comorbidities in terms of diabetes, hypertension, cancer, and so it is remarkable because we got to look at the figures, especially in the United States and England. We have been quite safe here in St. Vincent due to the Ministry of Health and the COVID Task Force team keeping Vincentians safe. But in the United States, in Brazil, in India, in certain parts of the world, there have been such significant deaths. We're talking about, 2,000 deaths a day and so forth. These sort of things, they baffle me. And I've practiced in the United States. And some people would say, oh, those are not real deaths. Those are fake deaths and so forth. And it's really unfortunate that we're going to have a massive effort to say that these vaccines are bad, that they're good, nobody should take them. And because the Ministry of Health has to go through the process of the protocols, you may not hear publicity, yes, take the vaccine. I am saying I will take it, as JERROL Thompson. But I believe that for the next few months, the effort to say don't take it, there's a chip in the vaccine, other people are going to profit, it's going to kill you, that is going to be front and forward first until I think a proper campaign is then mounted and people also get the evidence and so. Now I'm going out on a limb because what has happened, and if I should say, is that those vaccines have had what they call emergency authorizations. They haven't been fully approved yet, and I must say that. They have obtained emergency authorization because they are so effective, 90-something% effective. When you see something, you expect it to be 50, 60% effective, and it comes up 94, 95% effective, you can put it through emergency authorizations to have it now go in for use, emergency use. And that's what's really taking place right now in those countries. And the big question is whether or not St. Vincent and the Grenadines is going to get its share of the vaccine. We could all say we don't want it.
So tell us about that.
Well, I think I'll put this off to Simone.
So we are part of the COVAX facility, which is a consortium, is a group that was created between Gavi, which is a vaccine gatherer, purchaser, WHO and other agencies. And the goal was to ensure that all of the persons in the world, sufficient people the world over, have access to the vaccine. Bearing in mind that, there's some richer countries that might be able to buy up
all of it, most of it,
a good proportion, and leave some of the less wealthy ones without. But we understand that if that were to happen, it would not benefit the world because persons would not be able to travel. You need to have a good distribution of the vaccine. So St. Vincent is going to benefit from that organization where the intention of the COVAX facility is that we would be provided with 20% of our population, vaccine sufficient for 20% of our population, free of cost. That 20%, however, would not be sufficient to get us to a level of herd immunity, if we could use that phrase, with this starter vaccine. We need about 70%. So we are also going to be looking for additional financing to purchase that amount. Some persons might say, which vaccine? As yet, we do not know which vaccine we will get because the COVAX facility, as Doctor said, there's just so many. So the COVAX facility...
so they will determine which one?
They are going to try to secure sufficient of all of the approved vaccines and then dispense. Each country is asked, which vaccines would you want? So you have a list. Do you want the vaccine that requires, are you willing to take the one that requires minus 70 degrees? Or do you prefer, as we did, to have the ones that will go from minus 2 to 8, from 2 to 8, which is what we are accustomed to? Do you want something that is pre-approved or something that has emergency authorization or something that has gone through the stringent, already existing requirements for approval. So we were able to identify, say, which ones, what characteristics we would prefer to have, but understanding that we might not be able to say, no, not that. This is what we're going to get.
Okay. Somebody says, thank you, Dr. Thompson. I was very skeptical regarding the vaccine, but as an ED nurse, I'm considering taking it now. Somebody else is saying 95% effective, but with a very limited cross-section of the populace that it was tried on. Somebody wants to know, please tell us how long it takes for a vaccine to be developed and which country is being used for trials of the vaccine.
Okay, right. Well, again, there are about 170 different vaccine candidates. Russia has its Sputnik, China has about 6 or 7, Australia has some, Germany has some. The Pfizer vaccine is a US-German thing. The Moderna is also a combination of countries. As the Oxford AstraZeneca is US, England. There's all called a collaboration and combination. Now, the Pfizer vaccine actually may have had about 42,000 persons in the trial. The Moderna had 30,000. These are big trials. And they are considered to be quite large. Now, what they do, and if I could put this in a simple way, they do it as a double-blind, placebo-controlled trial. Let me say, the persons who get in it, so there are 30,000 persons, 15,000 would get a vaccine, the other 15 would get something like sugar water, looking like a vaccine. And the patients, none of them know what they're getting, and the doctors don't know who is getting it. So that this eliminates all the bias, and so you can't do a proper study unless you do it like this. And then, when they've gone through the process and all the steps in the trial, the data is collected, tests are done for COVID and all that sort of thing, and they assess. It's amazing, with the Moderna vaccine, 1 person died. But guess what? It was somebody who received the sugar water, whereas nobody who received the vaccine died. And the number of persons who received the sugar water who caught the COVID was quite large compared to that of those who received the vaccine, suggesting that it was really effective. And then, when they tested some of these persons and so forth, it really showed or suggested that they had been exposed, but they did not pick up the virus. So was it kind of like preventing them from even becoming symptomatic in the case of the Moderna vaccine? And they've been able to do a number of analysis. Now, they've had independent analysis. I tell you the truth, they've been able to put these things up online. I've been able to go and review some of these things. I wouldn't say I am an expert, but I have an idea in terms of how they would have gone through the process. And it's quite impressive how they're able to get 94 or 95% efficacy. Now, another vaccine may not obtain that same level of efficacy. And therefore, it may not be rated as high. And we are now seeing collaboration. The AstraZeneca and the Russian Sputnik vaccine are now collaborating with each other, sharing notes, sharing data to see how they can be improved. And other companies are linking up with other companies, as we see. And so there's a massive global effort and collaboration. And
that's a good note on which to end this segment. We'll talk some more when we come back. Back in just a moment.
Fire and dice. together on one scratch ticket can make your dreams come true. Yes, it's Fire and Dice. The new $10 scratch game with thousands of dollars to be won. Match your numbers with any of the winning numbers and win the prize shown up to $125,000. You can double or triple your prize with Fire and Dice. Available from all lotto agents and runners. There's cash to catch with just a scratch.
Welcome back, and we're going to start this segment by answering the following question. Given the fact that there's no evidence of community spread and all cases documented were imported from high-risk countries for the most part, how urgent is it for Vincentians to be vaccinated?
Well, I think it's not just so much because Vincentians are traveling people too, and people travel. And I think that's probably what the urgency is about. So how people continue to move again, JERROL. Move from St. Vincent, people who go for business. There's people who leave the country once a month to go somewhere, and So I think that is where the urgency is more than anything else. And of course, we spoke earlier on about the greater number of people that are coming into the country. So I mean, as that number grows, the risk increases.
Yeah.
And there's some conversation too people have been having about, vaccine, it took them how much? 10 years, 12 years, JERROL, to get the measles vaccine, and this one just came out the sky, But I don't think ever before there's been so much resources placed in developing a vaccine. There never has been, not just the financial resources, but the technology that's being used. There never has been anything. This is unprecedented, what has taken place. So, I mean, because the idea is that, they got it so quick, there must be some rush, half-baked kind of story. But the resources behind these vaccines are certainly enormous.
The United States warp speed, $18 billion put into this, and the COVAX is also a substantial amount.
So somebody was saying, but I think Roger just answered that. Dr. Thompson still has not answered the first part of my question. Please tell us how long it takes to properly develop a vaccine. I think you just answered that. And someone is saying, if I take the vaccine, I don't see any need for me to quarantine for 14 days, but I rather that than the alternative. Okay. All right.
If I could say something here, normally when a vaccine, the process of a vaccine, the studies and the development of it takes around the same time. After you put it in the application for it to be approved, it could take a year and a half before they come around to approving your or looking at your vaccine, and they may then send back for more information and tell you to go and check this again and so forth. So most of the time in the approval of the vaccine is the time it takes for things to be submitted and so on. And because of the urgency with this vaccine, I would admit that part is being speeded up. So as soon as the study is finished, the results are provided to independent individual, and they are ready to review it straight away, rather this year, in the next week, rather than in another year and a half. And I think that is part of the way in which the process had been speeded up.
Okay, let's bring things more local now. We know our neighbors in the, our compatriots in the north, in the south, move between our sister islands that have been witnessing a spike in the number of COVID cases. How much of a problem is this movement?
This is quite a problem. And it's not just the movement, but the movement is undocumented. So you have no clue who has come, who was gone. how long they stay there, how long they stayed anywhere. I mean, if you're moving, we know who you are, then we say, okay, go, this is the protocol, you come in, you test you, we put you in quarantine. But these are people who are just moving to and fro. And the spaces are wide, very wide spaces. The whole of the southern Grenadines is open, as well as in the north. And people come and go. We had some problems in the north, particularly, and this is notwithstanding, because we've done work, we've been doing some work, we've made visits to the area, we've spoken with people, and we let people know that we're not here ready to get in whatsoever business you have going on or anything like that. That's not what we want. We want just to keep you and the community safe. So we want to talk to you about, if you were to do this in your unlikely event, then this is what you should do. So we've done some work there. We see the health promotion team has also gone out. Even up to today, we had a team that was visiting the northern part of the country. But that's very, very worrying, because these people are undocumented and they would like to remain undocumented. Yeah. And that really increases the risk for us. So again, we're appealing to our people. I mean, you live in a particular place and somebody comes over from a neighboring country, you let us know. Or you see somebody who doesn't belong to the community and you suspect they've come from this place, you let us know that this person is there, so that we could go and try to make sure that we get this person, isolate them, have them tested, and make a decision about whether or not they continue to be here.
And at the Medicinal Cannabis Authority, we have also been reaching out in terms of certain parts of the country where the practice, especially in the legal trade, has been to move between different islands, to look at this more seriously. And I think we're going to intensify our efforts in talking to these individuals who we know of and we can reach. And I think this is going to help in one way.
Okay. And it's Christmas, 9 morning celebrations. Everybody wants to be up and about. How do we impress upon the minds of all that it's important that they remain safe and they follow the protocols at the same time?
Well, we say the same thing we said from day one, from the very first time we come here. Keep your distance, okay? Of course, if you're from the same household, then fine, then, you can be together because you're sort of bubble, so you do. But, just don't get involved in the bigger groups who you're not familiar with and people who you don't share your space with on a daily basis. Keep your hands clean, so you sanitize your hands as much as you could. And, I mean, if you were in crowded spaces, the advice always wear a mask or a face covering to do that. Stick to these, be alert, and, it's going to help you in keeping yourself, your family, and your country safe.
Are you at all worried or overly worried that we could probably see a repeat of St. Lucia or Grenada?
That's an existing risk. It's always there. Every day when you go to bed and every day you wake up, that's the first thing in your mind. It's always there. That risk is always there. Because this is very easy for us to get there, one simple person who comes, breaches a quarantine, somebody who enters illegally and so forth, that's all you need for that for this to happen. So the risk is always there. And it's something that we always worrying about, and that is why we do most of what we do. And that's why we spend some nights sleepless and some days working, simply because we're trying to avert this. But a lot of it is going to depend on people's personal behavior and people taking responsibility for themselves.
And so somebody's asking, before I go to doctor, okay, question, just keep moving. But Doc, let's talk some more about quarantine and isolation, because I think that in my own judgment, that seems to be quite an issue. Yeah, especially after the 5 days and people go their merry way. They think that
that they're fine.
Yeah.
So it is a challenge, and I think earlier on, so in October, November, persons would leave after their 5 day, and we might say to them, if you have to do something, you let us know, and we would say, okay, you can do that quickly, and you come back. I think that has now translated into, I have a document that says I'm on 14 days quarantine, medical officer's order. But once I'm finished with my 5 days and I have what would be 3 negative tests, there's nothing possible that could still be wrong with me, and therefore I can go. And we have seen earlier this week, last week, we had 3 persons who tested positive around day 9. And one of the cases that we reported on today tested positive around day 7, day 8. So even though, and these persons all had negative tests
On arrival.
So that they came with a negative test, and then we ran tests here on them. And it just goes to show that the virus might be building in you, but it is not at a level that it can be detected as yet, but it's still there. And so that when you leave the quarantine, the 5-day quarantine, and you go home, we really want you to go home and stay at home and to quarantine properly. Because the worst thing would be that you leave your home, you go to your friend, you go to your granny who has diabetes and hypertension, and she's very ill, and you go, you hug and you kiss her, and you give granny COVID. And granny suffers and, dies. So that's what we're just asking people to do. I know a lot of persons still say to us, oh, but I had no symptoms, I was fine.
Nothing.
We know now, as we had learned so early along, but it is even so much more obvious, the majority of people will be fine. They will have not a single complaint, but they can still spread that virus. And so we're just asking persons to really look out for yourself in doing this, and also for our neighbors, and so that because St. Vincent has been blessed, as in you can still walk around. Once you finish your 14 days, you can still go to church, you can still, still have a lime. Let us just, do a little extra before so that we could enjoy our Christmas and New Year's.
Doc, you have 20 seconds?
Yes. I want to say vaccines represent a bright light at the end of this COVID tunnel. In terms of how many vaccines, when they're going to come to St. Vincent, and so we're going to watch it very carefully. And so, but I want to really, once again, applaud the whole health force here in St. Vincent and Grenadines in terms of what they've done. Because, Roger, in the early days, we would say you can't even go to a goat cook, a river cook. Now we're able to go. Yes, and we have an element of freedom, because in other places, lockdowns and closed downs and shutdowns and slowdowns down have caused all sorts of mental problems and difficulties. We have that element of freedom. But coming to St. Vincent, that quarantine period must be strictly obeyed. That's the way in which we have protected our people. And so those persons coming, if you really want to enjoy the rest of your stay, please obey that quarantine process and stick to it, because I think that's where we're going to keep St. Vincent safe, and we're going to continue to handle the pandemic well.
And that's a very good note on which to end this evening's edition of Roundtable Talk. I want to say a very special thank you to our experts who have been coming here week after week since this crisis started. Doctors Duncan, KEIZER, BEACHE, and of course, Thompson. Thank you guys, and continue to do the work that you all put in to ensure that St. Vincent and the Grenadines remain safe. See you next week for another edition of Roundtable Talk. Good evening.